Welcome to the PruittHealth Pharmacy Training video on ordering and receiving. I'm Fred Augello and this is Joe Holt, and today we're going to walk you through the procedures. So let's get started. Ordering new medications. All new orders, including changes in dose, time, and frequency of existing orders, must be written on a PruittHealth Pharmacy interim order form. Remove the top copy and attach to the blue telephone order form. You can attach up to 3 orders on either the same or different patients. Fill in your name, the date and time, and your initials on the bottom of the blue telephone order form and fax to the pharmacy. After you fax to the pharmacy, check the confirmation report, verify that it says OK, and place the forms in the accordion file. New admissions. For newly admitted residents, orders are written on the New Admit Physician Order Form, otherwise known as the POF. In addition to the ordered medications, this form should include resident's room number, allergies, diagnoses, and billing information if known, such as Medicaid or Medicare. Once the POF is completed, the nurse should fax a copy to the pharmacy. Verify the orders have been received and check the fax confirmation sheet. Once this has been checked, you attach both forms together and place the forms in the accordion file. After the POF is filled out, the back part of the POF is the MAR, and you just need to place that in your MAR book when you start to give the medications to the newly admitted resident. Interim order forms. Orders received will be written on the interim order form. Complete all information on the form before faxing to the pharmacy. Check eKit for medications ordered. If medications are obtained from the eKit, note the number of doses removed from the eKit prior to faxing to the pharmacy. If no medications are needed, mark an X in the section which states profile only. The interim order form can accommodate up to 4 new orders. If less than 4 orders are requested on the form, place an X in the empty line section. Readmissions. Hospital or healthcare center discharge orders that are legible, complete, and signed by a physician, physician's assistant, or nurse practitioner are considered valid orders and may be faxed to the pharmacy on the original order sheet. An exception to this are controlled substances, which would require a phone order from the MD or a written prescription. Place a photocopy of the orders in the order and receipt accordion file along with the fax confirmation sheet. Transcribe the readmission transfer orders completely. Orders to renew all orders are not accepted. Steps for ordering non-cycled meds. Medications requiring refills are ordered on a medication reorder refills only form. Please check control boxes thoroughly for additional punch cards before reordering. To order, peel the reorder strip located at the top of the medication label. Affix the reorder label onto the medication reorder refills only form. Place an X on any blank spaces on the medication reorder refills only form. Fax back to pharmacy, attach the fax confirmation sheet to the medication reorder sheet, and place both forms in the accordion file. Controlled medications, which include tablets, capsules, injectables, and elixirs, should be reordered when a 7-day supply of medication is remaining. Note: scheduled routine PO medications will automatically be refilled. And now we're going to introduce the Advantage RX packaging system. One of the primary benefits of this packaging system is that it contains multiple medications for med pass time in one packet instead of multiple punch cards. Another benefit of this packaging system is that antibiotics, warfarin, and do not crush medications are packaged in individual packets. More benefits to the Advantage RX system include the pull and tear system, which saves significant time on MedPass administration, up to 55%. Package strips make it easy to check the medications against the MAR. Ophthalmics, inhalers, and other bulk item medications are stored directly behind oral medications for ease in locating. Time spent in reordering and faxing is cut up to 75%. Less medication waste, therefore time spent on monthly drug destruction is greatly reduced. The design of the Advantage RX system. Packages are in strips by date and time order, starting with the first dose due after the system arrived at the facility. Each patient has their own bin for Advantage RX strips. PRN medications are packaged separately and are delivered in a bag labeled with an individual patient label stored behind the Advantage RX routine meds. Benefits: improved accuracy. The Advantage RX system accurately labels all oral medications. Packages are labeled with all relevant prescription information that stays with the medication until administered. Packaged meds will contain the following information: patient name, physician name, pharmacy address and phone number, date and time of administration, drug name, drug strength, physical description of medication, lot number, expiration date, and prescription number. Additional benefits. The strips are designed to be placed against the MAR to review for accuracy. If a nurse is distracted while preparing meds, she returns to a fully intact pouch instead of blister packs to be sorted and staged. The system makes it easy to give a patient several days of medication for a leave of absence. Controlled substances will continue to be packaged in punch cards. To reorder controlled medications, pull the reorder label, attach to the medication reorder refills form, and fax the form back to the pharmacy when a 7-day supply remains.
Ordering new medications in the Advantage RX system. For new orders, fax orders to the pharmacy immediately after receiving the order from the physician. Include the diagnosis and the expected date and time to start med administration. If doses are removed from the emergency kit, note the number of doses removed and indicate the date and time the dose administration will begin. Managing dose changes. For a dose change, transmit to the pharmacy immediately so that the next Advantage RX cycle will reflect the dose change. Until the next cycle, highlight the old dosage with a yellow highlighter. During the med pass, remove the old dose and place in the red biohazard container and administer the new dose received from the pharmacy. A new dose strip will be received in the daily orders from the pharmacy. Managing time changes. For any dose given at a time different than the established standard time, write a clarification order on an interim order form with the time designated. Fax the change to the pharmacy the same day to make sure that the next Advantage RX cycle is correct. Until the next cycle is received, leave the dose in the Advantage RX pouch. Then tape the pouch closed after other medications are removed for administration if more than one medication is in that pouch. Discontinued medications and room changes. For discontinued medication orders, fax to the pharmacy the same day the order is written so that the next Advantage RX cycle is correct. For room changes, fax to the pharmacy on the same day the change is made so that the next cycle organizes the patient's medications in the right room order. For room changes made before the next cycle, move the entire strip from the old room bin on the cart to the new room bin. Cycled meds for hospitalized residents. For hospitalizations, fax an interim order form to the pharmacy indicating the resident is out of the facility to prevent the pharmacy from continuing to send medications while the resident is not in the healthcare center. If a resident is expected to return to the center within 24 hours, keep medications in the resident medication bin and compare readmission orders from the hospital to current facility POF to determine whether changes have been made. If a resident is out of the facility for longer than 24 hours, remove medications from the resident medication bin, write medications on the inventory and destruction form. When the resident is readmitted to the facility, transcribe a current list of medications to the pharmacy on a POF. New Advantage RX strip will be sent with the next routine delivery. Routine daily medications. For reorders, tablets and capsules packaged in the Advantage RX system are not reordered. Pharmacy will automatically run a new cycle every week and deliver these medications to the center. For PRN medications, are reordered when there is approximately a 4-day supply or 8 doses available. Controlled substances are reordered when there is a 7-day supply available. For topicals, liquids, ophthalmics, otics, inhalers, and insulin, they must be reordered as supplies warrant. MedPass, using the Advantage RX system. Select medications for administration time. Open the patient drawer and select the Advantage RX strip corresponding to the MedPass time. Pull the Advantage RX pouch away from the rest of the strip at the perforation. Check for any new orders that may have been received since the cycle started. Place the Advantage RX strip or pouch next to the MAR. Check that all tablets or capsules to be administered are in the Advantage RX strip. Note any discontinued medications and obtain medications not contained in the Advantage RX system from the appropriate bin or drawer. To open the Advantage RX pouch, hold the pouch in one hand and tear open from the perforated side. Empty the pouch contents into a souffle cup for administration to the patient. Do not touch package contents. Place the empty pouch in the light blue bin designated for HIPAA waste, which is located in the upper right-hand corner of your med cart. Crushing meds protocol. For meds to be crushed, do not crush medications will be packaged in a separate pouch with the notation, do not crush. These are to be poured in a separate souffle cup. For tube feeding patients, crush each medication separately. Flush with 5 milliliters of water between each medication or per MD order. For other patients, medications can be crushed together, capsules can be opened and the contents can be mixed with the other medications. Pour crushed tablets and capsules into souffle cup and mix together in medium specified by the facility, such as applesauce or pudding. Meds requiring crushing in capsule form. If package contains capsules, empty capsules to souffle cup prior to crushing. For capsules with powder, pull open the capsule while wearing gloves and empty the contents into a souffle cup with crushed tablets. For capsules containing liquid, wear gloves, puncture capsule, and squeeze contents into medium specified by the facility for administration. If resident has a G-tube, capsules and tablets must be administered separately. For a partial tablet, if a whole tablet plus a partial tablet is needed to complete the dose, the label will print as separate lines. For example, quantity 1 designates that you have 1 whole tablet. Quantity 1 times 1/2 means that you have 1/2 of a whole tablet in the package. Discontinued or hold medications. Identify the med to be held or discontinued by highlighting the description on all packets in the cycle strip. Check the printed description that matches the color, shape, and markings on the tablet or capsule. Open the package. Hold the discontinued dose and pour remaining medications in the souffle cup. Waste the held medication by placing it in the designated red biohazard waste bin. Leave of absence. Remove the Advantage RX pouches for the dose times that the patient will be out of the center. Instruct the patient or the caregiver on medication and times in the designated Advantage RX pouches. Remember to fill out the release of responsibility form and have the caregiver and the nurse sign the form before releasing the medication for the leave of absence. Receiving medications in the Advantage RX system. Each Advantage RX strip will arrive in the regular pharmacy delivery once weekly. Each center will receive 1 pizza roll for each medication cart. The first dose from the new cycle will begin at the 6 a.m. dose following the delivery. Doses needed prior to 6 a.m. should be in the current cycle. If these are new orders, please remove the medication from the e-kit or obtain the med from the backup pharmacy. The nurse receiving medications must sign for the tote being delivered from the PruittHealth Pharmacy Services driver. The nurse will separate the Advantage RX strip by patient and place the strip in each patient's medication cart bin. The nurse receiving the cycle is not responsible for checking each patient's meds. The medication will be validated on the first day's MedPass. Please notify the pharmacy and complete a medication discrepancy form immediately if any discrepancy is found in cycle meds. Medication variances in the Advantage RX system. If there are med discrepancies found in the pouch, use the communication form found at your facility to report any discrepancy to the pharmacy and fax the form back to the pharmacy. Provide complete information, including patient room number and administration times. Administering meds from the e-kit. Complete all of the information on the emergency drug kit utilization record. Tear off the white copy and tape to the new order and receipt sheet and fax back to pharmacy promptly. Place the middle copy, the yellow copy, inside the e-kit drawer from which the med was removed. Pharmacy communication. When a clinical or formulary concern is identified, the pharmacist will complete a memo and fax it to the facility. This memo may be handwritten or computer generated. When received at the facility, a nurse reviews the concern and communicates with the physician to resolve the concern and to obtain a new order, which is promptly sent to the pharmacy. Getting the most from the Advantage RX system. Communicate with the pharmacy early and often. Remember to send order changes immediately to the pharmacy. Remember to send room changes, discharges, or hospitalizations the same day they happen. Remember to notify the pharmacy of any discrepancy immediately. Remember cutoff times. Remember formulary drugs. Remind physicians as needed. Remember to send in for refills promptly for non-cycled meds. Notify the pharmacy of any order discrepancies promptly. Notify the pharmacy of any discharges, admissions, transfers, leave of absences, and new orders in a timely fashion. Review the pharmacy communication orders in totes or faxes.